kind of problem that involves pain. It can be acute pain or it can be chronic pain. It is very important to try to address people initially with acute pain so that it does not become chronic and so that we don't have secondary problems. The types of treatment that we use, as I've mentioned, are the PRRT and the ETPS. Those are just two types of treatment that are different than you find in a lot of other clinics.
So what exactly kinds of success have you had then in dealing with this new technique?
Well, we see many different kinds of problems, such as rotator cuff pain, knee pain, plantar fasciitis. We see people with thoracic outlet. We see people with neck and back pain. But the two areas that I think are really impacted a lot in our clinic are migraines.
Oh, okay.
As well as fibromyalgia.
Okay, that's big.
Those are two areas of pain that traditional therapy doesn't always help as well. And so I have found, since introducing these new techniques, that we have been able to help those patient populations significantly more.
Okay. Get back their quality of life.
It's very important to them to get back into the kinds of things that they want to do. And many people don't want to take medication for headaches. Makes them feel very groggy. Many people don't want to take pain medications forever.
Right, and I know that a lot of people, when they do take the pain medications, it upsets their stomach.
Right.
So you're kind of outweighing one for the other as well.
Right, you have all those secondary effects from some of those things. So I think if we can treat people more conservatively with things that move them back to their lifestyle but don't cause secondary problems, it's really important.
Yeah, sounds great. I know. Now, when I'm thinking about this, of course, I'm so used to, you mentioned that it is covered by insurance, but my thoughts go to, do you need a doctor's referral, anything on that line that a patient needs to come and see you, or if they've already had their doctor's permission and they seek you out on their own, or what exactly protocol do they have to follow?
Okay. Well, there are two things that help them know what they have to do. One is, what does their insurance require? So for the insurance end of things, the patient just needs to call their member services and find out if they need a doctor's prescription or not. Our Practice Act in the state of Minnesota allows people to come directly to us. If they have a new problem without a doctor's prescription, they can go to a physical therapist for 90 days in the state of Minnesota before they would have to see a doctor. If it's an old problem that's been documented, then they can go directly to a physical therapist without a doctor's prescription. So they just need to find out what their insurance requires, and then if it is an old problem that they've had for a while, and the doctor can give us a diagnosis for that, then we can go ahead and treat that patient as long as it is medically necessary.
And also, I know a personal friend that has seen you, so that's also you have some really great success rates with a lot of your patients.
We do patient satisfaction questionnaires all the time so that we can make our treatment as effective as possible, and we want to know from our patients what they think about the care they've had. And with the respondents that we've had, usually they rate their satisfaction at a 9+ on a 1 to 10 scale. So, so we have had patients that have been very happy with their care. The other thing that is important to know is that most of the patients that we see have been to a lot of different places. So, so it would be nice to think that we could deal with problems when it was easier to treat.
Right.
But very often we see people that have had their problem 4, 5, 10, 15, or 20 years.
Oh, so they've actually exhausted all of the Western ways or Western medicine, either by a prescription, and now they're almost to the point of not even having a good quality of life.
Well, very many of them don't have a very good quality of life. I had a patient in last week who just said, I don't know if I can go through my life with these headaches the rest of my life. So people express those things all the time, and it is just really important to be able to address that. And I'm so thankful that I'm able to come on your show, because many patients don't realize that they have some alternatives, that there are some techniques out there that may help them. These techniques do not help everyone, but I have seen probably only less than 1% that they did not help in some percentage, in a certain amount. So usually most people respond. Some people have conditions that aren't going to go away, but at least they can move back into a lifestyle that is more fun.
Yeah, or half of their life back instead of just sitting in a rocking chair.
You know, and the other part of our clinic patient population is also helping people that maybe have medical problem, like they might have osteoporosis, they might have an old injury, and all they would like is some guidance in developing a new exercise program. So we help people that are, I'm going to say well loosely, but you know, that are moving and doing better, but we can still help people that want a little more guidance with what they're doing.
So you have a variety of range from, you know, someone that actually is sitting in their rocking chair all huddled in a actual blanket, not thinking that they want to even go on, to also a person that may have hurt their ankle in some aspect or twisted their knee, and it's just not quite right. So because being a physical therapist, you can take the range from 1 to 10, from almost hurting a little bit to major pain as well. Yeah,
so we see, you know, a wide range of patients. We see many more that have had problems for a long time because they have given up and are, you know, have tried a lot of the more traditional techniques. Now, we still use traditional manual therapy techniques in our clinic, traditional exercise, but I think the model that we use is a little different, and then these 2 new techniques that we use have made a huge effect.
Great, wow. Well, I know of one person that had a fantastic story, and I'd really love for you, if you could, share that story with my viewers.
Yes, well, originally her doctor referred her to me, and when we get the referral, we call the patient to make an appointment. And I left multiple messages and she did not return my call. So I just, you know, let that go. And probably about 6 or 8 months later, I got another referral from the same doctor for the same person. And so I called, and I happened to catch her at home, and we talked for a few minutes, and I said to her, you know, I've called before, this is the second referral, so what is it that made you not call back or set up an appointment? And she said, well, you know, I've tried a lot of things and I don't think anything's going to help.
She had given up, actually.
She had given up.
She had been through, I believe, 10 to 12 doctors prior to reaching out to you. And she thought, oh, I just don't want to go through one more, because she'll get her hopes up and she felt that she might get let down again.